The Grozile district has the highest incidence of COVID-19 cases, followed by the Castries district. The island has recorded 241 cases in the last 14 days, including 3 COVID-19 related deaths. The findings are based on information collected from March 2020 to January 2021. Chief Medical Officer Dr. Sharon Belmar-George broke down the incidence, links and distribution of COVID-19 cases during a NIMAC press briefing on Wednesday.
To give you an idea of the case distribution of our 713 positive cases that we've noted throughout Saint Lucia, the bars give you an idea of the number of cases and their distribution throughout the various districts, and the incidence rate is the blue line. At this point, the Grozile area has the highest incidence of cases being noted across the island, and this data is from the 11th of March to January 20th.
The distribution of cases indicates that the highest incidence and numbers are from the age group 25 to 49. Dr. George says about 10% of the total cases are students.
I think it's important that we note that the typical school age accounts for 11% of our infected population. We have the various age groups, that is the preschool, infant, primary, secondary school, to give an idea of the numbers that we are seeing within these. The 25 to 49 remains our highest numbers and the incidence for the incidence as well per 10,000, and this relates to what we're also seeing in the contact tracing process relating to increased social activities of that age group.
Mass crowd activities and socializing are being blamed for the spike in cases. The CMO disclosed that the majority of the latest COVID-19 cases did not necessarily attend social gatherings but were close contacts of persons who did.
In January, we note the increases coming on. So we are at a very critical point now in January with the increased number of cases that we are seeing, and as I indicated earlier, from the 12th of January, we're seeing the secondary effects of the activities, that is, persons who did not necessarily attend high-risk activities, but the families of those persons and also their contacts, be it at work or other social activities. So that is what we're picking up in our contact tracing.
Dr. George says the main risks which may contribute to continued transmission of COVID-19 include international tourism, illegal entries from COVID-19 hotspots, failure to adhere to protocols particularly at bars, breach of home quarantine, and poor use of face masks in public. Saint Lucia, as of Wednesday, recorded 713 COVID-19 cases with 418 recoveries and 287 active cases. There is currently 1 person listed in critical condition. Gina Filippi, HCS News Force.